It's time for Back to Life, brought to you by Southwest Spine and Pain. A 30-minute conversation with their board-certified physicians about how to live life again, pain-free.
Hi, this is Dr. Rick Obrey from Southwest Spine and Pain, one of the practicing physicians. And today we're going to be talking about stem cell therapy and how stem cell therapy can be used effectively to treat a host of chronic pain conditions, including musculoskeletal disorders. But before we get into talking about stem cell therapy, I want to tell you a little about who I am and a little bit about Southwest Spine and Pain. So my name, as I mentioned, is Dr. Rick Obrey, and I am originally from Utah. Grew up in northern Utah, Cache Valley, and I went to Utah State University, did my undergrad there, and I also did a master's degree in biochemistry at Utah State. Before I went on to medical school, I went to Baltimore at Johns Hopkins University School of Medicine. I was at Johns Hopkins for 4 years. I completed my medical degree there. I had a great time there. And then I went to the Mayo Clinic in Jacksonville, Florida, and did an intern year in Jacksonville, which was also very helpful. I then returned to Baltimore and finished a residency in diagnostic radiology with emphasis on interventional radiology for 4 years. And then I stayed at Johns Hopkins for 1 year and did a musculoskeletal fellowship in MRI, where I was responsible for reading most of the MRIs that would come through the musculoskeletal department, including spine. And then I was also responsible for doing all diagnostic bone biopsies for the entire Johns Hopkins system. And then following my fellowship at Johns Hopkins, I went to the Mayo Clinic in Rochester, where I completed fellowship training in interventional spine and pain. I'm married with 3 children, which keep me pretty busy when I'm not working. Again, I moved to St. George, Utah about almost 8 years now, a little over 8 years ago, predominantly to practice spine and pain. My brother, Dr. John Obrey, who I work with at Southwest Spine and Pain, had been here for about a year. At the time, they were building a spine program, and he was recruited to help start the spine program as part of Intermountain Healthcare. And once he was here and realized the need, he recruited me to come here and also work with him and help develop the spine program. That was a long time ago. That was really almost before the Health and Performance Center was built, and there really wasn't a spine program at that time. Now we have 3 neurosurgeons and several spine surgeons that are part of that program. So we're very, very proud of being involved with that. A little bit about Southwest Spine and Pain. Southwest Spine and Pain was started by myself and my brother, Dr. John Obrey, and Dr. Derek Frieden, again, about 8 years ago. It was started here in St. George, Utah, where we really wanted to emphasize bringing high-quality pain care to St. George and the surrounding regions. And that was our goal from the beginning, is to try to provide safe, effective, and cutting-edge health care to the region. One of the nice things about being at the Mayo Clinic was we tended to see things from all over the world, and that gave us a perspective on both simple pain conditions, but also some of the very complex pain conditions. And we're very grateful for the training that we had there. From St. George, we then expanded across the state. We have clinics really all over the state of Utah now, but St. George is our home, and that's really where the 3 of us continue to practice. So that's enough about me, and let's get into probably what people want to hear about. And one of the most common things I hear about as a practicing physician that performs care in spine and musculoskeletal conditions is stem cell technology and stem cell therapy. So I want to talk a little bit about what it is and what it isn't, some of the research behind it, the cost associated with these therapies, and some of the do's and don'ts. So if I was a consumer, I was out there thinking about, is this something I should consider? What are the risks? What are the benefits? I'm kind of taking the approach of the patient in this case. So what is stem cell therapy? Well, stem cell therapy means a lot of different things to a lot of different people. What we're talking about as far as musculoskeletal and spine applications, it's taking several different types of products and potentially injecting those, or either through interventional techniques or through surgery, into areas where there's damage. So when you hear about stem cell technology and stem cell therapies that you're probably most commonly hearing about, It really has to do with three different types of injections. So as it applies to spine and musculoskeletal conditions, what are the types of stem cell therapy? Well, the first is something we call tissue allograft injections or tissue allograft therapy. So what does that mean? Well, most of the products you hear that contain umbilical cord products or placental products are examples of tissue allograft products or tissue allograft injections. So these are the products that potentially contain stem cells, may or may not. They also contain growth factor cytokines and so forth. Some of these products have been used for many, many years. Placental products have been used for wound healing and burn victims for 20 plus years, and there's a fair amount of evidence for that. More recently, these types of umbilical and placental products have been used for musculoskeletal conditions, joint pain, knee pain, tendon injuries, and so forth. So what are these products? Where do you get them? And what are the risks associated with them? Well, the first thing we talk about with these types of tissue allograft injections is it's important to understand a little bit about the FDA regulation and what is the regulation associated with these products and what are kind of some of the protections for consumers. Well, the FDA regulates these tissue allograft products basically through federal mandate and federal legislation. What they say is these products can be used as long as they meet certain criteria. So if we're going to use a tissue allograft product, it has to meet certain FDA guidelines. And these FDA guidelines are provided to manufacturers of these products. So a classic example would be something like an ACL graft. I recently tore my ACL, had surgery about 6 weeks ago, which was an interesting perspective for a doctor to be a patient. But an ACL graft is where you take an ACL ligament or you take a ligament from a donor, someone who has passed away, and you take that ligament and then you apply it to the patient who has the torn ACL. That's an example of a tissue allograft. So you take tissue from a donor and then you apply that tissue to the recipient. In my case, an ACL. So would be an example of that. Now, for a company to do that and produce those types of products, there has to be several criteria that they meet. Number one, it has to be used for the same purpose. You can't take tissue from someone else and change it or alter it and have it be used for a completely different purpose than the recipient. That's what they call homologous use. It's very important. The other thing that the FDA regulates with these tissues is it has to be minimally manipulated. So you can't take tissue from a donor and change it in any substantive way and then try to use it in the recipient. Because the FDA says, well, look, if you're making changes to the tissue, it's not really performing the function that it was performing in the donor. So there could be changes that could affect how that tissue would work in the recipient. So that's kind of a simple illustration for tissue allograft injections. And why is this important? Well, it's important because I hear, not just regionally, but nationally, a lot of claims about these tissue allograft products. And I've had patients that have spent tens of thousands of dollars on treatment for these tissue allograft products, and their promises are life-saving treatments in many cases in respect to cancer. And then I also hear statements about there's some kind of special sauce, or this product is secretive and it's only available through this manufacturer. Well, remember, the only way a tissue allograft product can be injected is if it meets those two criteria. It has to be homologous use and it has to be minimally manipulated. So a company can't manipulate the tissue in order to do these. So if you're thinking that you're receiving a stem cell, quote-unquote, tissue allograft procedure, and there's some kind of special sauce that someone is providing, well, that's not in accordance with FDA guidelines. Now remember, FDA only regulates the manufacturers. So the other key piece to consider if you're considering tissue allograft injections is who is providing the product, and that's a very important question. So when we started doing stem cell injections 5 or 6 years ago, and we started doing research into this, I saw dramatic variability in the types of products that were being produced by different companies. And not exaggerating, I saw one company that was producing stem cell, quote, tissue allograft products in a garage next to a motorcycle that was being rebuilt. That's not an exaggeration. And then I saw companies that were producing these products in what you would consider a sterile lab, where they have the white jumpsuits and the key cards and the air filtration systems, and they have FDA logbooks. So one of the important things to consider before any type of tissue allograft injection is that you understand the source of where that product is coming from. Because why does that matter? Well, the critical part of that is if a lab is following the FDA guidelines, there's very strict regulation of these tissue products, and it's monitored by the American Association of Tissue Banks. But what that guarantees to the person receiving the injection is it's been checked for all known viruses, it's been checked for bacteria, it's been checked for pathogens. And if a company follows those guidelines, the risk of receiving an infectious agent is about 1 in a million, or similar to what it would be like if you're receiving a blood transfusion. If someone is not following those guidelines and they're getting these products and they're not being closely regulated, then there is no assurance that you're being protected. Now, most physicians who are aware and are doing these types of injections are going to be aware of that, and they're not going to use faulty products. But as a consumer, you have to be aware of that, because I have seen instances where the consumer was at risk because of this product. So that's tissue allograft, kind of a basic overview. And those really can consist of the umbilical products and the placental products that you hear about and are advertised. And those show a lot of promise. Now, the one thing to consider about these tissue allograft products is there isn't a lot of research data on that. So what do you mean by that? Well, there's certain types of evidence that we expect before we perform a medical treatment. And having spent a lot of time at medical institutions that place a high emphasis on research, it's important for the consumer to understand that with these types of products, we do not have large randomized double-blind controlled trials for these tissue allograft products yet. Now, I've worked as a consultant to try to establish some research protocols to look at these products, but there are no really what I would consider level 1 evidence. That's the randomized double-blind controlled trials for these products yet. They're coming. It'll happen. But most of these studies range from $10 to $100 million, so they just haven't occurred yet. So what does that mean for the consumer? Well, that means that when you are having these procedures done, there is a certain amount of risk that goes with that. You have to understand until the data comes out, number one is it may not be effective. Number two, there may be risks associated with we don't know about yet. Until those studies are done, those risks are out there. And really until we see large numbers of patients treated, there's a certain amount of risk that the patient has to be willing to take. Now, having done and performed a lot of these procedures, we are aware of a risk, and I've actually done stem cell injections on myself, but that doesn't matter. There's still risks associated with that. Until those studies are performed, there's no way to mitigate that risk completely. So that's something for the tissue allograft injections that needs to be understood. And any time a patient was having this type of injection, one of the critical pieces before that injection were to take place was something called informed consent. So what's informed consent? Informed consent means that whoever's performing that procedure needs to have a discussion with the patient about risks, known risks or potential risks of these types of products. And if you've received one of these injections and you have not had an informed discussion, then that may or may not be a problem, because particularly with the tissue allograft injections, that informed consent is important. Now, that doesn't mean that these types of procedures can't be performed. I've performed many of them, but the patient needs to be aware of the risks associated with those types of injections, and that's a really critical finding. And any physician who is doing things the right way is going to have that discussion with the patient. So that's tissue allograft injections. What's another type of stem cell injection that you can be done? And another type is something called bone marrow aspirate or bone marrow stem cell injections. So what is this, and how is it different from tissue allograft injections? Well, bone marrow stem cell aspirate injections are really just that. You take bone marrow aspirate, usually from the patient that's receiving the procedure, and then you redistribute that bone marrow aspirate that is rich in stem cells into another location. So a classic example that we do quite frequently is we take bone marrow from the iliac bone, which is in your hip, and we take that bone marrow aspirate and we re-inject it into the knee joint or under the cartilage in the knee. That's an example of a bone marrow aspirate injection. Well, why would we do that? Well, it turns out that bone marrow is one of the richest sources of stem cells in the body. And it's rich in a particular type of stem cell called a mesenchymal stem cell, or an MSC. That's something that you may come across. But that's why we use bone marrow, because it's a rich source of stem cells. Now, some of the limitations of the bone marrow aspirate stem cell procedure is that you have to do the bone marrow aspirate. And I have lots of patients come in, they're like, "Doc, I've heard that is so painful. When you put that needle in the aspirate in the bone, man, it was really painful." I've heard that coming from other patients. Having done hundreds of bone marrow and bone biopsy procedures, if you do it the right way, where you numb the tissues, it really should not be that painful, just from experience. but that's a common complaint. But that is one of the limitations, is you do have to aspirate the marrow, and that requires putting a needle into the bone and actually pulling that marrow out. But again, that done with someone who has a lot of experience, that should not be a particularly painful experience. So let's talk about evidence for bone marrow. So there is actually some evidence, and a little bit more evidence for bone marrow aspirate type stem cell injections than there is for some of the tissue allograft injections. So what is the evidence? Well, turns out there's an orthopedist in France who's been doing bone marrow stem cell procedures for a long, long time. He's treated thousands of patients with bone marrow aspirate patients. And one study that he discussed recently at a national meeting was a study involving knees. Very common to get osteoarthritis in the knees, and that generates pain and functional limitations. So he took 40 patients. Both knees were bad. And he did a total knee replacement on one of the knees. And on the other knee, he did a bone marrow aspirate stem cell procedure. And he followed these patients anywhere from 5 to 15 years. And he discussed his findings. Well, long story short, at the end of the study period where they followed these patients, they looked at pain control, they looked at functional improvement, they looked at morbidity, they looked at complications. And 28 out of the 40 patients said that they would do the bone marrow stem cell procedure prior to a total knee replacement. Now, these patients were in their 80s. Now, let's not get overly excited about this, right? This is 40 patients, and that's a very small sample size, but it was interesting that 28 of the 40 said they would do the bone marrow stem cell procedure first, which is interesting. Now, what were some of the reasons for that? Well, they looked at complication rates. There were no complication rates in the stem cell treated knee. There were 3 serious complications at 3 of the 40 that had, well, I think one was a blood clot, one was a stroke, and one was I think it was a heart attack, but I'm not exact. But 3 serious complications. They looked at transfusion rates. There was about a 20 or a 30% transfusion rate for the total knees. There were no transfusions required for the stem cell procedures. When they looked at functional improvement, pain control, it was similar between both groups. So the astute consumer out there is going to say, well, yeah, sure, 28 of the 40 said that they would do the stem cell procedure before they did a total knee, but that doesn't necessarily mean the stem cell procedure worked. It could mean that the total knee surgery was so bad that they didn't want that. So, but I think the truth is probably somewhere in between. The total knee was probably partially painful, especially for the patients who didn't do well, and then the bone marrow aspirate procedure, the stem cell procedure, was probably very effective. So that's something that we watch very closely. We have been doing bone marrow aspirate procedures in our clinic for quite some time. Treat a lot of patients. I've seen patients who have done very well. I've seen patients that haven't responded. And even after having treated many, many patients, it's very difficult to determine who does well and who doesn't well. So that's bone marrow stem cell aspirate procedures, which is commonly done. That's a little bit more involved than the tissue allograft injections, because you actually have to aspirate the bone marrow to do that. So that tends to be done and offered primarily by by physicians who have a lot of experience with performing interventional procedures. And whereas tissue allograft injections, you can pull it off the shelf and inject it, kind of like you're injecting a steroid injection. It's just you're injecting very, very expensive injectate, assuming that it's coming from a legitimate company that's actually following the guidelines, which is an important point to understand here. Most of these procedures are fairly expensive. And one thing to consider is you can make these procedures less expensive. Like I can inject something and call it a stem cell injection that has very little product in it and may or may not be screened, and offer it for a very cheap price. So price, particularly in this field, doesn't necessarily equate with quality, and that's really on the consumer. You need to investigate and understand where the products are coming from and who's actually doing that, because there's a floor that we've seen as far as these types of procedures. And when you start to see pricing below that minimal price, I start to question what's being injected and where they're getting it from. So that's a little bit of a buyer beware there with that. If something's too good to be true, it may be too good to be true. So what's another source of stem cells that you can hear about and that we see? The other source that is fairly rich in stem cells is actually adipose tissue. So we talked about tissue allograft from umbilical and placental tissue. We talked about bone marrow aspirate from bone, and now we're talking about adipose tissue. So what's adipose tissue? Adipose tissue is just fat tissue. Fat tissue has a high concentration of stem cells as well. And you can take a needle with there's several kits where you can pull out fat tissue. You can minimally process that fat tissue, and that product can be used for stem cell injections as well. And these are commonly performed around the country. I probably see less adipose tissue requests than I do for bone marrow and the tissue allograft procedures, just because the FDA kind of came down a little bit on adipose tissue companies because they were taking fat and they were processing those samples with enzymes that would break down the fat cells, and the FDA felt like that processing process could change the structure of the tissue, and that for a while they didn't feel that it met the minimal manipulation criteria. So a lot of those companies kind of fell by the wayside, and there have been new ones that have come. And it's also something that we offer if a patient has done their research and they feel very strongly about adipose tissue. That's something that we offer as well. So we talked kind of about and then the fourth way, one more thing to talk about. So the fourth way you can get stem cells is through donor stem cells. So these are ones you can take stem cells from a patient, you can grow them in the lab, and then you can inject those stem cells. Now, that does not qualify as a tissue allograft injection or what we call an autologous use injection, which is the case for bone marrow and adipose. So that is regulated by the FDA very differently than the three that we've previously described, the three types of stem cell procedures. So anytime you take cells, you grow them in the lab, and then you re-inject those cells, or you add something to them, or you manipulate those cells in any way, that qualifies as a drug, and that requires different testing to be used. So just like testing for a new drug, you have to do the same types of testing for these products. So now we've participated, Southwest Spine and Pain, in national research using these types of products. So there was a disc trial that we were involved in, one of about 15 to 20 groups around the country who was asked to participate in that study, where we took stem cells that were grown in the lab and we injected those into patients, and we looked, and that study is still ongoing, to see if it's effective or not. So that's another way you can get stem cells. Now that can only be within an FDA-approved trial. Now you hear about patients going to Panama, and you hear about patients going to Grand Cayman, sometimes Tijuana, although a lot of that's been discouraged. That's what they're doing. A lot of times when patients are going out of the country, they're trying to get stem cells that have been grown and reintroduced into patients. Sometimes their own cells, and sometimes cells from donors. So that's where those cells are coming from and why it matters. Now, let's talk a little bit about cost. So what do these types of procedures cost? I've seen ranges anywhere from about $1,500 all the way up to $30,000 and sometimes $40,000 for these types of procedures. So how can that be? Well, a lot of it depends on what you're getting. If you're getting cells that were taken from your bone marrow, grown in culture, and then re-injected into you, that can be done, say like in Panama or Grand Cayman, the costs associated with that are much higher. If you're taking tissue allograft injections, then those costs are going to be lower depending on what you inject. A general term, or a general thing to take into consideration is usually if you have someone who knows what they're doing and are using through qualified services, the cost it's hard to get the cost below $2,000 if you're actually injecting what I would consider products that have been vetted. That's just the realities of the cost. Now I think those costs will come down in the future, but right now, at least until we figure out how to make these products cheaper and how to test more efficiently at less cost, a lot of the cost is just in procuring the tissue and then testing it to make sure it's safe. So we're just about out of time here. I appreciate you taking the time to listen to some of the things we're talking about. We're hoping on a weekly basis to present educational material to the public about some of the things that we see just as practicing physicians. Hopefully that's found to be helpful. So we'll talk about stem cell again. This is a very large topic that's going to change everything we do with medicine, from cancer therapy to tissue transplant to how we treat premature infants. Autism is something that it's going to be used to treat. And there are several studies ongoing right now. And again, the goal of Southwest Spine and Pain is to be able to find cutting-edge treatments and make them available to our areas, not just urban areas like Salt Lake or Las Vegas, but rural areas like Richfield and Cedar City and St. George. So if you have any questions, feel free to contact your physician, who will probably have a lot of his information to provide about these types of procedures. Be happy to someone from Southwest Spine and Pain would also be happy to talk to you about potential applications of stem cell therapy for you or for someone that you know. Again, this is Dr. Rick Obrey from Southwest Spine and Pain, taking the time to talk a little bit about stem cell. And it will be someone from our group will be on here every Monday to talk about these potential issues.
Join us for Back to Life every Monday at 5:30 p.m. here on St. George News Radio, where board-certified physicians from Southwest Spine and Pain discuss different alternatives to live life again pain-free. For more information, go to southwestspineandpain.com.